So, coming to our dear friend, Mr. Subiro, this is the brief history of this patient. 20-year-old male, he is a resident of Dushanbe. He developed some complaints of bleeding and fever in October 25. He was diagnosed in the home country to have acute myeloid leukemia. He took next flight to India. This is a brief summary of this patient. This patient had a bacterial pneumonia when he presented to our hospital. In patients with acute myeloid leukemia with pneumonia, you cannot take this patient for chemotherapy. He received immunotherapy, azacitidine, venetoclax, that's a standard treatment, for 2 cycles, to which he did not respond. Pneumonia responded, but AML did not respond. So, by the time his pneumonia responded, he was fit to be taken up for the chemotherapy. He received 1 cycle of flag chemotherapy. Unfortunately, his disease, that is AML, did not respond even after the strong flag chemotherapy. If you Google 2 patients with refractory AML survive, it shows very poor prognosis and it stops there. 3 months is the median survival if these patients are otherwise not treated properly in time. This is the medical literature that supports the same. Patients with refractory acute myeloid leukemia have a very less or poor survival to the tune of less than 20%. Only 20 people will survive long time, and the chances of them getting into remission with whatever treatment is less than 40%. So that's the medical literature that is available. So what we did was sequential bone marrow transplant. And what is sequential bone marrow in conventional case? What we do? I am the patient, Mr. Bashir is the donor. I get admitted, take the chemotherapy, and on the day of transplant, that is day 0, collect the stem cell from him, and my transplant is done. In case of sequential bone marrow transplant, please ask your doctors, whosoever is doing bone marrow transplant, what is sequential bone marrow transplant? Sequential bone marrow transplant means the patient who is not in remission, despite whatever efforts, you give chemotherapy to this patient, give a break of 5 to 6 days, and take this patient for transplant in the same admission. What it means is the first chemotherapy that you are giving, the perspective and reason for that chemotherapy is to somehow get the disease controlled to whatever extent. And thereafter, when we proceed with the chemotherapy of the transplant, that transplant ultimately can lead to long-term cures. We have seen this before, and this is what we tried for this patient this time also. He underwent this sequential allogenic bone marrow transplant. His brother as a donor, brother has gone back to his own country, and now he is 1.5 months post-transplant. And post 1.5 months of his transplant, at present, his bone marrow is showing no disease. He is MRD, that is the highest possible measure of measuring a particular disease, is 0. The chimerism is full. So this is what we have achieved in this patient after a lot of things, and probably Vashibhai will tell sometime later. Try to rename. Dipaliji will be happy to see this. MAH stands for Marengo Asia Hospital, but I try to call it as most accessible hospital is Marengo Asia Hospital. We do all type of treatments for different type of hematological diseases. Any hematological disease that is available, that is possible on this earth. These are the bone marrow transplant indications. So Raktaveer is our social program, and what it means is all people who are suffering from any type of blood disorders are Raktaveer. Raktaveer means blood warriors. So any person suffering from any type of blood disease is a Raktaveer to us, is a blood warrior to us. Some happy smiles, happy faces. Sometimes we are in good news. We help establish hospitals or bone marrow transplant centers across India also. Before I come to the end, I think I'll go to this. Can you just play this? So we just try to incorporate some AI version. I'll just come to this, and after that we are done. Okay, can you play this video, please? Can you play this video? 1 minute.
Hello everyone, my name is Subiro. I am from Tajikistan. Welcome to India, Subiro. We take care of you now. Yes, everything is ready. Thank you so much.
We'll help you recover completely.
That's the AI version.
Marengo Asia Hospitals.
Here's your medication. Take as directed.
Thank you. I'm doing much better. You've made remarkable progress. Your recovery is inspiring. The transplant went well. Your vitals are excellent.
We're here if you need anything at all.
Thank you so much. I feel good. The treatment is working. I feel so much better. Your results are excellent, Mr. Sobirov. We're very happy with your progress. Just make sure you're comfortable.
You're doing well. Continue follow up.
Thank you, doctor, for everything.
Thank you, Dr. Meet, Dr. Niraj, the whole team. Thank you, Marengo Asia Hospitals. I feel very happy now. Thank you so much for the care. I came with refractory AML, but here I found hope and expert care. Thank you. Safe journey, Subiro. Stay healthy and keep in touch.
Yes, thank you, doctor.
I will. Thank you, India. Goodbye. Goodbye. Thank you, India. Goodbye. Welcome aboard to Tajikistan.
That was the A version. Hope, I think most of you would like it. That's what our expectation is. But before we end, let's just request Mr. Bashir to share. Mr. Bashir is the voice of the patient at present. So I'll request Mr. Bashir to share what the patient wants to share at present of his experience of getting the treatment at Marengo Asia Hospitals, Gurgaon. So over to Mr. Bashir.
Hi everyone. जब मिस्टर सुब्रो का वीडियो वेरी वन कंडीशन मैं आएंगे डॉक्टर रविंद्र सर के पास ये सर बोलते कि 5% चाहिए tomorrow but now person tomorrow alhamdulillah 100% okay but thank you Dr. Amit sir your team Dr. Niraj sir your BMT team thank you so much my patient is okay now alhamdulillah
Alhamdulillah soon.
voice now master voice now now 100% okay now thank you sir for doing